The WHO has been at the forefront of battling the coronavirus, which it declared a global health pandemic almost a month ago. The United Nations Health Agency is warning that the disease has now started spreading to the rural areas, and this could signify a new dawn in handling the crisis, particularly in Africa, where the health infrastructure is weak compared to urban areas.
This means countries need to localize the response by urgently strengthening the existing public health and primary healthcare infrastructure in countries.
WHO Director Tedros Adhanom Ghebreyesus also warned against lifting restrictions, saying that there was a likelihood that the disease could lead to resurgence. He said that there were factors to consider before lifting restrictions.
First, the transmission is controlled. Second, that sufficient public health and medical services are available. Third, that outbreak risks in special settings like long-term care facilities are minimized. Fourth, that preventive measures are in place in workplaces, schools, and other places, whether it's essential for people to go. Fifth, that importation risks can be managed. And sixth, and I cannot overemphasize this point, that communities are fully aware and engaged in the transition.
Dr. Ghebreyesus also expressed fears over the number of medical staff that were being infected by the virus.
In some countries, there are reports of up to 10% of health workers being infected. This is an alarming trend. When health workers are at risk, we're all at risk.
Most of the health workers are being affected for lack of protective equipment or outside the medical facilities.
Within health facilities, common problems are the late recognition of COVID-19, or lack of training or inexperience in dealing with respiratory pathogens. Many health workers are also being exposed to large numbers of patients in long shifts with inadequate rest periods.
He said that the WHO was working to expedite the procurement and distribution of equipment to countries that needed them most.
WHO has launched 3 tools to help managers and planners calculate the health workers, supplies, and equipment that will be needed for the increase in COVID-19 patients.
The number of infected people has reached over 1.5 million people worldwide. Kenya has now confirmed about 200 people with 7 deaths.